Well, good afternoon, everyone, and welcome to In Conversation, COVID-19, HIV, and what comes next. My name is Tracy Evans, and I'm Ride Director for TogetheRide and AIDS Life Cycle. It's my great pleasure to be here today. For those of you that have been here for our past 7 shows, you know that we have a regular moderator, Russell Roybal, but interestingly enough, he's one of our guests today, so hang tight to see Russell's smiling face. If you'd like to view closed captioning for the show, please use the scan the QR code up in the corner, or you can check out in the chat on Twitch or Facebook Live for the link. If you have questions for today's guests, please ask them in the chat and we will answer them at the end of today's show if we haven't already gotten to those questions throughout the conversation. Now, today's program, as I said, is our 8th and final In Conversation for TogetheRide 2021. Over the last several months, we have explored all sorts of topics that really revolve around the mission of the Los Angeles LGBT Center and San Francisco AIDS Foundation. Today, looking at COVID-19, HIV, and what comes next seems like the natural transition, as yesterday California reopened after 15 months of being closed. And so today we're going to really dive into what comes next for the agencies, what comes next for our clients, and a whole lot more. Today, we have 2 terrific guests. As I said, spoiler alert at the top, our first guest is Russell Roybal, the Chief Advancement Officer at San Francisco AIDS Foundation. Russell works alongside the development team, volunteer services, marketing and communications teams, and of course with us at AIDS Life Cycle. They lead fundraising, volunteering, communications, and branding efforts that resource the programmatic efforts and advance the foundation's mission. Previously, Russell was Deputy Executive Director at the National LGBTQ Task Force, where they directed programmatic and policy work, and the National Conference on LGBTQ Equality, Creating Change. Russell also served as Deputy Executive Director of External Relations and as Chief Development and Communications Officer. The task force advances full freedom, justice, and equality for LGBTQ people. Russell has served on the staffs of the Gill Foundation, YEGO, the National Latino LGBT Organization, the San Diego LGBT Center, and San Diego Pride. Russell was honored by the California LGBT Legislative Caucus as a Pride honoree in 2017 and was named Grand Marshal of the San Diego LGBT Pride celebration that same year. They are also the recipient of the Harvey Milk Social Justice Award and the Jose Julio Sarria Civil Rights Award. Russell was the inaugural recipient of the League of United Latin American Citizens Equality Award. As a Latinx, male-bodied, non-binary queer leader, their activism is rooted in a family tradition of public service and the pursuit of social justice. Russell was born in Hollywood and grew up in La Puente, California. When Russell's not working, they're likely underwater scuba diving or living their best life on the dance floor. Now, there's a lot of commonality that you are going to see today between our 2 guests. And so our next guest is Darrel Cummings, Chief of Staff of the Los Angeles LGBT Center. Darrel works closely with senior management to ensure the smooth day-to-day operations of the Los Angeles LGBT Center and holds final responsibility for the internal management of the organization. He also plays a lead role in directing the organization's external relations efforts, including its work in public policy advocacy, its participation in significant coalitions, its relationship with other community-based organizations, its private fundraising initiatives, and its efforts to obtain government funding. Darrel has worked in nonprofit organizations for nearly 3 decades and has held numerous paid and volunteer positions in the lesbian, gay, bisexual, and transgender community. From 1993 to 1999, he served as the Deputy Executive Director of the Center, and in that capacity, served as the Senior Manager for all programs and related government affairs. During his tenure as Deputy Executive Director, he oversaw the procurement of millions of dollars annually from all branches of government, the development of many new and innovative programs, and overall internal management of the Center's program and policy efforts. Cummings also provides Darrel also provided national advocacy leadership related to the HIV/AIDS and social service needs of the LGBT community. Before rejoining the center as Chief Operations Officer in June 2003, Cummings served for 2 years as Deputy Executive Director, wait for it, for the National Gay and Lesbian Task Force, and previously held upper-level management positions in several organizations representing the needs and rights of low-income people, women, consumers, and the LGBTQ community. These two fine gentlemen are really wonderful. They both shared same title of job at the task force, and I have the great privilege and honor every single day to work with them. And it is time to bring them in. So, gentlemen, where are you? There they are. I like how I'm reading the official bio and Cummings. Well, hello, you guys. How are you?
Hi, Tracy. It's so good to be with the two of you, longtime colleagues and friends, and with all the people that are here that have supported the center and the foundation in the past, currently, and will do so in the future. So it's great to be here. Thank you.
Well, I think, Russell, how's everything in San Francisco?
It's great. The weather today is spectacular. It feels like a Los Angeles day, actually. And so I'm excited to be here in a different role, not as playing hostess like I usually do for the conversations, but to be here with you, Tracy, and with my longtime friend and colleague, Darrel Cummings, who I was excited to follow in the Deputy Executive Director role at our beloved task force, and who has been a mentor to me since I was a young queer activist. And even before I took this job at San Francisco AIDS Foundation, I gave Darrel a call and said, should I go there? So thank you, Darrel, for always being such a great mentor to me, and always willing to listen and give me advice when I need it. I have appreciated it, and I don't think I would be where I am without your guidance. So thank you.
And right back at you, Russell.
Wow. I need to get in on that. Well, actually, I am in on that. And what's great is that I get to work with both of you and count you among friends, colleagues, and mentors as well. So I am very excited to be here today. I know I cannot possibly wear the stilettos of Russell Roybal, but for a variety of reasons, but I will try to do my best today in this discussion. You know, on March 13th, 2020, many of us went home thinking we were going home for 2 weeks for a test run to see what was going to happen. That weekend, the state of California closed, and things changed very rapidly for all of us. And I think I would love to start today's conversation by looking back at the last 15 months. So much has happened. I mean, so much has happened with AIDS Life Cycle, with TogetheRide, with both agencies. Russell, let's start with you by talking about what your top takeaways have been from the past 15 months. In the big picture, what have you and the foundation learned that you're looking to continue as we look forward?
Well, I think I would start by saying that the support that folks who are out there doing the TogetheRide now, or who've done AIDS Life Cycle in the past, really helped to buoy us. So I want to thank all of you for your constant support and love of both San Francisco AIDS Foundation and the Los Angeles LGBT Center. I think what we have learned over the last 16, 17 months is a couple of things. One is that our pivot to virtual services has been really a complement to our in-person services. Because there are some folks who don't want to get on public transportation, might live far out from our in-person sites, or have a disability, or be homebound, or not be able to access services in a traditional come to one of our sites locations. And so we've been able to learn a lot about how to continue to connect with those folks through a virtual experience, including partnering with Google, which we did earlier this year, which was to provide phones for folks who did not have a computer or a way to access things remotely. And so that was a really great and innovative way for us to partner with a local partner and continue to be able to provide those services. I think the other thing that we knew before, but that it was made even more clear, is that housing is healthcare. In San Francisco and in the rest of the state, we are facing huge housing shortages. And the more someone has stable housing, the better their health outcomes are. And so really that reminder that housing is an issue for all of us to be concerned about, because it affects the public health and the healthcare of the communities that we come from. And then the final thing I'll say is that it reminded us, which we have known in the HIV world for many years, decades, that Black and brown people are disproportionately affected by things like pandemics, like the HIV epidemic, like the COVID pandemic. That is not new information, and it only shed even more of a light on the disparities that Black and brown people face in their access to healthcare. And that is particularly true in California and in the cities, and certainly in the city that I live in San Francisco. And so we need to do better to center the experiences and the lives of Black and brown people in our work.
Wow, great. Thank you, Russell. Darrel, how about in Los Angeles?
Well, the short answer is everything. We started this back in February when we realized that COVID was coming our way, and probably in a big way. And, we have 800 employees and about, the tens of thousands of people per month that rely on us from services. So we had to figure out a way to keep our services going, whether they were in person or virtually, all, with brand new methodologies that we had not used before, because, we had to figure out how people were able to get services in person safely, and keep our, make sure that our staff were operating in a way that they were going to be safe. We, in addition to, a variety of services that are in the healthcare arena, we also are home to hundreds of young people and seniors, and that's not going to change. So we had to really learn how to do everything differently, but continue to do everything. And I feel very proud that we were able to do that. And in the process, we learned a lot that I think, it's a little, I think for many people, it was pretty emotional to find ourselves going through yet another pandemic and feeling this sense of responsibility. And I think we've lived up to it at both organizations pretty well. But we found that not only in addition to the disparities that Russell was talking about, we uncovered a whole community that was in need of, housing, food, company, and all kinds of things that were directly related to the impact of COVID. And so we created, a food pantry and a food delivery system in which we could make sure that people who were food insecure could get enough food to get them through week by week. And we solicited help from volunteers all over Los Angeles to call seniors, for example, that were isolated in their homes, so that we could identify issues, whether that's medications or food or other things that those folks needed, and then provide them, but also to provide them some, let them know that there's a community of people out here that cares about them, that's looking out for them, that wants to talk to them, so that the health, the health consequences of isolation, which we know are terrible, could be ameliorated in that way. So, I think we have learned how to do things that we didn't know how to do before. And just one other example, we have found that our providing our mental health services through telehealth actually has huge advantages. More people show up for their appointments because they don't have to, hop on two buses or or to get to our facilities. And our therapists tell us that they're having much greater breakthroughs with many of our clients as a result of the safety and distance that telehealth provides. So there's a lot of things that we're going to keep as California begins opening up, and as we open up our services even more. So I'm gonna stop there, but really the answer is we've reinvented ourselves several times in the last 14 months, and I think for the better.
That's wonderful. Thank you, Darrel, and Russell for sharing all of the great work. I feel, again, just so privileged that I get to be part of it every day. And I know our team is so committed to the work, and everyone at both agencies, making sure that the clients are getting what they need to have safe and healthy lives. So we're at this pivotal moment. The state reopened yesterday. It kind of feels like a great moment of hope. I think it also feels like a great moment of, okay, what's next? So Darrel, what is next? Do you have a crystal ball, and can you tell us what's next? And what does it mean for the state to open? What does it mean for the center?
So it means something significant for the public. From a employee standpoint, we are governed by Cal OSHA, which sets standards for workplace. Those are due to be released probably tomorrow, so we'll have a better sense of what that means relative to social distancing and masking and all those sorts of things. And the regulations are really different for congregate living, which we have, and healthcare environments. So, we're still waiting on some details about that, but I think what it means is that for our events and our other services, we can start doing much more in person when that makes sense, and we can do it with an understanding that both from a staff standpoint and a client standpoint and a community standpoint, we can do it in a way that is just much safer than we've been able to do in the past. And so, and we are also making it a requirement of working here at the center that all of our staff are fully vaccinated, so that anybody coming into our facilities for services or to visit for other reasons can know that they can interact with staff without fear of possible infection. The final thing that I'll just note is that there are still new variants out there. And we have to keep a really close eye on that, because as we open up, there's going to be more variants coming our way, and we don't know if any of them will be able to evade the vaccine. So we've got to be prepared to pivot back to what we've been through for the last 6 months, if unfortunately we're required to do that for a while. So and just on a last point, we still have to advocate to make sure that vaccines are readily available to all communities, so that the disparities that Russell has talked about are not continued and magnified simply because it's not easy for people to get the vaccines where they are, where they live, where they work.
Thank you for that, Darrel. You used a word that I really hope can leave our lexicon forever, and that is, if we never have to use the word pivot again, if we never have to pivot again, it would be really magnificent, right? So, yeah. Darrel, Russell, how about over at the foundation? Obviously, both agencies have a lot of healthcare, and are rooted in healthcare, but there's so much more. So, what does opening look like for the foundation?
Well, I want to start where Darrel left off, which is vaccines and access to vaccines by community members. We were a vaccination site, and we prioritized meeting the needs of our clients, our trans and gender non-binary clients who didn't have access to healthcare, our Black, Indigenous, and other people of color clients. And one of the things we're actually doing this week is that as Darrel said, that this is not over. There are still new variants, and there are still many in our communities who need to get vaccinated. And so this week is Juneteenth on Saturday. And so we are having our Our Black Health Program is having an event tomorrow, a social event. Now that things are open, but observing, of course, all the protocols. But we're also going to be offering vaccinations, Johnson & Johnson vaccinations to the community at that site. So we're trying to do that in other places too. And I think, so there's those pieces. And then, folks are having sex again. I mean, they probably didn't stop having sex, but maybe they were not having the kind of sex they had before the pandemic. And so we want folks to know that we're like open for business, and we're encouraging folks to come back in. We saw a dip in PrEP enrollments and PrEP prescriptions and testing. So that is starting to ramp up. In fact, since the start of the year, we've had over 600 PrEP enrollments or re-enrollments, with the bulk of them happening in the last couple of months. So, the reopening test means like getting all of that ramped back up to speed for folks to be able to come in and get tested. We never closed our doors, just like the center never closed their doors during the pandemic. And so, but we want folks, we're certainly seeing some of that taper off, but we want folks to come back, to get back into care, to get their PrEP, to get their STI checks and testing and access services at all of our sites.
Thank you, Russell. Now, so there's what's happening at the agencies, but then there's the role of the agencies as leaders in LGBTQ space, in public healthcare. So how do you view the role of each agency as we move forward into this next chapter of COVID-19? Russell? Darrel?
Well, I mean, I think that there are certainly lots that we have learned that both Darrel and I have talked about that will affect how we move forward. We're still figuring it out. As Darrel said, there's still some guidance that we need to understand better as we continue to fully open. Right now, our Castro location is open, but we're doing only limited groups at our 1035 location, which is in Mid-Market. And then our Harm Reduction Center, which is on 6th Street, has been open throughout the pandemic, but not at the capacity that we had before. So all of that is kind of, we're learning new things about that as we continue to open, and really taking the lessons that we've learned over the pandemic that we talked about earlier around a hybrid model of virtual and in-person services. Because like Darrel said, there are some folks who just took to the virtual services in a way that had better outcomes than if they were being seen in person. So where we can do that and where that can be successful, we certainly want to employ those things. And then, just get back to a place where we can start having volunteers come back in. We had to suspend our group volunteer program, and next month in July, we'll be piloting groups coming back. And so that's very exciting because folks have been wanting to come back and volunteer at the organization. So as we continue to open and take the lessons that we learned over the last year and a half and implement them, we're excited to welcome people back.
Thanks, Russell. Anything to add over?
Well, I would agree with everything that Russell just said. I mean, I think there's cause for celebration here. We've gone through this period of time, and people are going out to dinner now and feeling like they can do that safe, and getting together with friends and family and all of that. And that's that's a sharp contrast to what we've been through. And so the center will open in a similar way, stage by stage, to more and more people as we go through these next months. But I think the other thing is that this last year, and the many events that happened during the course of the last year, including COVID, I think have, made visible to everybody the impact of bigotry and racism and economic disparities that have been always so evident to those of us who worked in the HIV field, concealed for a long period of time. But I think it's evident to the country right now. And, we have, thankfully, a very different administration in Washington. And so, it's imperative that while we open up, that we don't open up to accept things as they've always been accepted, but that we continue to advocate for the changes that we know need to be made for the health and well-being of everyone, especially historically marginalized communities. So I think that's a big task for us, that where there is a window of opportunity that we need to really jump through and make happen. So.
But
Thanks so much, Darrel. I think,
Tracy?
Go ahead. Yeah, of course.
I mean, I think Darrel's exactly right. Like, I do not want to go through another cycle of this and be like, and have people be shocked that Black and brown people have these huge disparities in their access to healthcare, in their access to food, this is something that we've known for a long time. We've known for decades in the HIV movement. And we have responsibilities as institutions in our communities to make sure that we continue to address these issues that not necessarily have been brought to light because of COVID, but have been exacerbated by a second pandemic.
Right.
I mean, we're really dealing with three pandemics: HIV, COVID-19, and the public health crisis that is racism in the United States, and that so many of our community members face in their daily lives, that they can't access quality care because there's not a trust. I think part of the thing that I think both of our agencies have done is to really try to build trust in communities of color, in trans and gender non-binary communities, because the more someone trusts their provider, the more they're going to access care. And I think we need to double down on that as we emerge from COVID, so that folks know that this is that San Francisco AIDS Foundation, the Los Angeles LGBT Center are places that they can continue to come and be treated with dignity and respect and welcomed.
Thank you, Russell. I mean, it's the perfect transition to the last year and a half has been COVID-19, but right in the middle of it, we've seen the continued murder of Black people by police and nationwide protests. How did, I think the racial reckoning that started last summer, how is that influencing and impacting the work that's happening right now, in addition to what you just talked about, Russell? And I should say specifically, what are the changes that the foundation is making to address systemic racism and to not just break down cultural barriers or access barriers, but beyond that?
Well, all of us have work to do around the way racism and white supremacy works in our lives and in our institutions. And several years ago, 4 years ago now, the foundation started a strategic planning process that we are now going to be entering our third year of a 5-year plan. And we talked about centering the needs of Black, Indigenous, and all folks of color, trans and gender non-binary folks who use drugs, folks who are over the age of 50. So that has to be real. And I think we did that before the onset of the pandemic, before the murder of George Floyd. And so we were in a place that I think we could respond to it in a better way than some other organizations. Now, I say that not to pat ourselves on the back, because we are also late to the party. So this is something that our institutions in San Francisco, we should have been paying attention to many years ago. And so we are reflecting and acknowledging the part that we have played in perpetuating white supremacy and anti-Blackness in the public health system and in the way that we deliver our work, and owning that and really trying to learn and move forward in a way that makes our work better and more inclusive, and that people feel like they can trust us as a provider and a partner and somewhere that they can access care. So I think that is continuing. This movement did not start to happen last summer with the murder of George Floyd. There have been decades, right? Centuries of the oppression, primarily of Black and Indigenous folks, but all people of color. And so I think we just need to continue to acknowledge that, continue to understand how to center the lives of folks of color in our work, and continue to move that work forward, and acting with humility, and being humble about the things that we don't know and where we need to learn, and not put the burden of teaching that on folks of color or transgender non-binary folks, right? Or folks who use drugs. That there are lots of resources out there for us to be able to access and to learn. And we're doing that in our own agency. And that work is lifelong. There's not a stop and a start. It's constant. And we're committed to do that at San Francisco AIDS Foundation.
Wonderful. Darrel, anything more to add
from
the center perspective?
Echo many of the things that Russell was saying, but I think we, in our community and organizations like the center, we tend to think of ourselves as very progressive people, and we're always on the right side of issues, and we're always learning, and we're trying to be better for all communities. But I think the events of the summer were a real jolt, and caused us to have a lot of personal and professional reflection, and open ourselves up to criticism and evaluation, and plans for change that as Russell said, have been long overdue. And so we've engaged in a full staff process that has been looking at and changing our program delivery, our policy and advocacy work, and the way that we, hire, train, promote staff, create leadership opportunities, especially for people of color communities. And so it's as Russell said, this is a much needed step forward, but it's a series of steps that never end, and we just have to, I think, always be prepared to evaluate ourselves, to listen to other people, to make changes that are kind of required, so we can go home and sleep at night saying we're part of the struggle, we're part of the solution, and our work shows that. So I am somewhat optimistic that the work that both of our agencies are doing and the commitments that we have made are shared by organizations and people throughout the country, on issues like, as simple as the right to vote. So, we are very committed to this. We're getting help from lots of different places. We are coalescing with Black-led organizations, color-led organizations on campaigns that we think will really matter. And it's incumbent upon us to not just talk the talk, but put resources behind it, and even change who we are and who's making decisions and through what mechanisms of input. So, it's an important moment for us to live up to. And I think for the people that are on this call, who have, shown a strong commitment to eradicating HIV, we have always known these things, and we've always seen them up close and personal. And now it's about, I think, challenging and creating the systems that have maintained a status quo.
Thank you so much for that. And thank you to the commitment from both agencies to the work. As Russell said, this is lifelong. This doesn't, we got there, we're done. I think the commitment that both agencies has is tremendous and is hard. It's hard work. So just a big thank you. Darrel, we've talked about what the response has been, things that we've learned, how we've adjusted and pivoted. But now I'd like to just pivot a little bit into what do you see as the changing needs in the communities? And I think there's some ripples that will come as we hopefully are going out and away from COVID-19. But what are some of the big things that you see as needs in the community?
Well, I mean, I think the answer to this is consistent with the rest of the conversation that we've had. We know that there has been and is increasingly an enormous problem with people that don't have homes, and that problem's getting worse, especially in major metropolitan areas like LA and San Francisco, because housing costs are so great, and we can't sort of talk about racial justice or LGBT equity and inclusion. Like, we can't talk about our missions without acknowledging that part of what has to happen is that people have to have food, and they have to have housing, and they have to have healthcare as rights. And so not only do we have to make sure that the services that we're providing that have become so visible to everyone speak to those particular needs and across all of our communities, in our case, that make up the LGBTQ community. But we also have to advocate to make those things part of the system. California has got to recognize and deal with homelessness, for example. The federal government finally has to make healthcare a right, and in a way that doesn't, bankrupt people, and where people have access to it and doesn't discriminate and all those kinds of things. So I think what's in front of us is not only getting back to the work that we were doing, but expanding our services and our commitments to make sure that all communities, regardless of their needs, are known about, are seen, and that those things are addressed. And I think we're in the process of evaluating everything in order to do those things, in addition to making sure that our governments, our elected officials, do the right thing on behalf of the communities that we serve.
Thank you, Darrel. And one of the things I've been thinking about, I heard a statistic the other day that we got all of this help for housing in California during COVID. 1 out of 5 unhoused people now are housed. 1 out of 5. This does not seem like a celebration moment. It seems like a moment of, oh my God, there's so much to do here. So thank you for bringing that up, Darrel. It's so important. And Russell, are there any other needs of the community that you see ahead changing, evolving, or coming out of COVID that we're going to have to pivot in San Francisco?
Well, I think that the thing that this is, I'll just give you a very alarming statistic. In San Francisco, more people have died of overdose than of COVID. And so that is a problem in many of our communities. It is an issue that is solvable, but there has been a huge backlash. So getting Darrel said about making sure that folks are voting and electing folks to office who can address these issues, there has been a huge backlash nationally around syringe access or needle exchange programs, where a lot of counties or cities with Republican majorities are ending these programs. When all the science and data point to the fact that they lower hepatitis C transmission, they lower HIV transmission, and those programs then get people, if they want, into treatment. And I think in San Francisco, we're fortunate that our county government and our state government believes in those programs, but it's also about convincing residents of the city why those programs are important. And so we still have some work to do around that. As I said, the statistic that I started with, having more folks die of overdose just was exacerbated during the pandemic. People were more isolated. more alone, not connected to community. And so we certainly have work to do around that, because all folks should be treated with dignity and respect and have access to healthcare. Or a conversation I was just having the other day, have access to a bathroom, right? Everyone should be able to have access to a bathroom, and to it is maddening that in this time that we have not been able to solve those issues. And so there's lots of work left to be done, and our organizations are doing our part, but we're one small part of a larger issue. And Darrel said that the center is coalescing with other organizations. We're doing that too, and we're only going to be able to do that together. And that is why it is so important that you are raising money through TogetheRide, through AIDS Life Cycle when AIDS Life Cycle comes back, because those resources enable us to be able to fund the programs that we don't get support from the government or grants that enable us to do that work. The money that you raise lets us put the money where it's most needed, because it's unrestricted and it's flexible. And so thank you for all that you're doing out there to fund the work of both of our organizations, because we really do provide life-changing and life-saving services.
Thank you, Russell. And I was just actually, this is the last kind of topic that I have before we open it up for questions from the audience, which is, first of all, to say a big thank you to the folks who've been doing TogetheRide. Many of you have been with us for a long time doing AIDS Life Cycle, and you're here this year and you're helping to make a difference so that we can keep these critical services going. And as we make changes into the future, have that bridge. I would love to just have a few minutes from each of you, or a couple of quick minutes from each of you, about how are the agencies doing financially, and what are the funding needs to ensure keeping programs and services going as we move into this next phase of life. Darrel?
Yeah, well, just to be completely honest, it's been a real struggle, I mean, the loss of the AIDS Life Cycle last year was extremely difficult, and we lost all of our public events. But I also have to say that people really stepped up and recognized the positions that all of our organizations were in, and made contributions that they never made before. And so we're so appreciative of the people that have done that have stood with us, that have recognized the financial impact of this pandemic and what it's had on important organizations like the Center and the Foundation. And I so can't wait for ALC to return, not only because the money that is raised is so critical to our ability to do important work, but to feel like, wow, we're back and we're in a community, and we love each other, and we're an example of what we hope the world would be. So it's just it is a struggle, but there have been many times during the course of this last year where we've had people show up with handmade masks and with donations out of the blue, small and large, and the people who've done the TogetheRide have been very inspiring. And so, as always, we've been nimble, and we've been able to get through this period without having to cut any services whatsoever or lay off a single staff person. And that is a testament, I think, to the types of organizations that we are, but more importantly, to the communities of people that surround us and support us. So again, thanks to everybody here for that generosity and commitment.
Thank you, Darrel. And Russell, any additions over at the foundation?
Well, I would just say that it's been a struggle for us too. Folks have risen to the occasion, and but the loss of a traditional AIDS life cycle over 2 seasons, 2 years, has been hard. And we've had to make some choices related to that. Our 340B pharmacy program, which provides unrestricted revenue for us to be able to invest back in our programs, has also not performed at the levels that we expected because of the pandemic, because of drug maker pricing. And so we've had to dip into our rainy day fund, our savings account, to cover that. But we had to lay off some staff a couple of months ago, and it was a very hard thing. We have not decreased our services, but we had to make some choices in order to preserve frontline workers and our frontline services. And that's always a hard decision, and it is something I wish certainly we didn't have to do. But in order to preserve the long-term fiscal health of the organization, we had to do that. And so we are, like Darrel, we are looking forward to the return of AIDS Life Cycle and the rest of our in-person events. We had to cancel all of those too, or pivot them to virtual, and they just were not as successful as they were previously. And it's really disappointing because coming into 2020, our fundraising events were setting records. It was like things were firing on all cylinders, and then that all just got wiped away, and there was no way to plan for or to control for that. And something that it just happened, and we had to roll with it. And so we're looking at coming out of the pandemic a stronger organization, but it's been a rough last year and a half for sure.
Yeah, it has. And man, we're looking forward to the day when we can get all of those things back on track, especially AIDS Life Cycle, as someone who has a very vested interest in bringing to life an event that raises, well, $17 million in a year. That is so important for the agency. So this is where we are right now. So with that, we have a couple of questions that I am going to hop over here. And one of them, we've talked a little bit about this, but this is a really specific piece of advice someone is looking for over on Twitch. There's been a lot of talk of medical mistrust over the past year and a half. What would you recommend I tell friends and family that feel that doctors and medical professionals can't be trusted with our health?
Well, facts matter. I mean, I would start there. I mean, what I have found is that there are two types of people that are resistant. One is the biggest group by far around the country are white Republicans who voted for Trump. And I don't know what to tell those folks other than, please read the literature, and I'll support you all the way to get your vaccine if you're willing. But more what we found is, the bigger issue is access. It's not resistance, it's access. And that's why I was saying earlier that it's so important that we pay attention to this and make sure that people have access to vaccines. And there are people that are afraid of the vaccine. They've heard certain things. They have family histories. They have, in some cases, religious beliefs. But what we have found is that talking one-on-one to people and finding out where are the areas of concern, and then going right to conversations that both validate what they're feeling, but also provide them with additional information that helps them overcome those resistance. It really does work. And that can be from, healthcare providers, but it also can be from friends and neighbors and other family members. And I think right now we're getting to the point where we've got, a certain percentage of people that are unvaccinated, and we have to figure out ways to have discussions with them to help them understand that, getting vaccinated, first of all, is safe and very effective, but also it's a gesture made not just for them, for their friends, their families, for all of us. And this is a real collective effort. And this is where, we have to ask ourselves, are we a community of people that cares about everyone? Or are we just individuals that care about ourselves and our own thoughts? And I think the former wins, if we can find ways of communicating that to people.
Thank you so much, Darrel. Great answer. Great answer. And we have one more question. Russell, I'm going to, do you want to add in? Yeah.
Well, I would just say also, in particular for queer people, we have to come out to our healthcare providers, right, throughout our whole lives. And sometimes our healthcare providers don't have a competency in our care. So I think part of it is finding a provider that that you feel comfortable with, that you can have these conversations with. And if you're in Los Angeles, if you're in San Francisco, if you're in another area that has an LGBT health clinic, go to that clinic and find a provider that knows your community and knows the challenges and the questions that you might have as someone who is sometimes left out of the traditional models of healthcare.
Yeah, and just to kind of put a final point on this. I mean, in discussions within our own community, where I know people have been resistant, I have asked people if it was 1985 and there was a vaccine for HIV and AIDS, would you have taken it? And I mean, it really takes people back, at least of a certain age, to a moment where the answer was, of course, we all would have. And we've done it for ourselves, and we would have done it for our entire community. And, I mean, there's other obvious arguments to be made, like, aren't you glad we don't have polio?
That's wonderful transition, Darrel, as if you could see what the other question is here, which harkens back to 1985. HIV activists, this is from Facebook, HIV activists are responsible for so much of the public health infrastructure that has enabled us to fight COVID-19 and have a vaccine in record time. Do you feel that HIV activists and workers have been properly recognized for their contributions and sacrifices? Would like to take
I'll start there. I think that there's been some mention of it. Certainly, Dr. Fauci has talked about it, but I think it doesn't get said enough that the struggles that we went through to basically construct an entire healthcare system as a community, because our government was watching us die and didn't give a fuck about it. Right? Like, actively was homophobic, actively ridiculed from the White House podium. Our community, we had to build it ourselves. And I think that those struggles in those early days of HIV that have paved the way for the vaccines that we're doing now, the emergency use authorization would not exist without HIV activism, without people, closing down the FDA or laying in the streets or doing direct action. Like, there is so much we have to thank the activists in those early days for what we have now and for the speed at which we've been able to develop the vaccine and have these processes that were really a part of the wins that occurred because our community came together because no one else was going to do it except for us. So I think that doesn't get said enough. And there's so much we have to be thankful for folks who have come before us and for groups like ACT UP who were just not going to take it anymore and really put the pressure on to create the changes that enabled us to have what we have now.
Thank you, Russell.
My answer to that question is no. The acknowledgement hasn't been nearly what is deserved. And we haven't even acknowledged ourselves. I mean, we haven't had time to acknowledge ourselves. We had to create the most comprehensive, holistic healthcare operation that this country has ever seen. I mean, because of activism, a person with HIV can come into a medical clinic and not only get treated regardless of their ability to pay and get the medications they want and get the mental health care, but they can also get housing and food and transportation support and all those kinds of things. That exists because of activists that demanded that it must exist when, as Russell said, the government didn't want it, didn't care, wouldn't respond. And, I mean, we've been busy riding 545 miles from San Francisco to Los Angeles on bicycles, for crying out loud, to be able to make sure that, we could stay to our commitment and serve our community. And we have vaccines today because of activists, as Russell was also just talking about. So, we have never taken a break to even acknowledge the tremendous loss that we have experienced, much less the heroes who have taken on leadership roles and the rank and file of people who cared about HIV in the community impacted. So, I feel that every single day. Both the consequences of what people have done since 1981, and the work that is yet to be done, that has been made so visible this year. So it's a really good question. I wish there was a Nobel Prize coming everybody's way. I wish there was an opportunity to stop and really acknowledge the tremendous work and effort that has been done over these 40 years. But hopefully we all know that in our hearts, and we see it as bicycles are going down PCH.
Thank you both, and thank you for including, since 1994, riding down the coast of California as a part of the activism to make the community support network system, healthcare, all exist. And to everyone who has ever had a part of that, who's watching today. And happy Pride Month. Well, I was going to say, and to everybody who's watching today and is part of Together Ride, who's been part of this movement for 10 years, 20 years, 30 years, 10 minutes, or 40 years, thank you. Thank you, and thank you. It is time for us to wrap up. I could talk with these guys all day because I love hearing them speak about everything. For our community, thank you for being with us. Together Ride, we have 2 weeks left. There's still time. Together, we have raised more than $2 million, ridden hundreds of thousands of miles, all in an effort to bring dollars to support the agencies and attention to the continuing pandemic that started 40 years ago. There are still plenty of ways for folks to get involved. First of all, I'd like to mention that at 10 o'clock this morning, we announced our friends at Gilead another match challenge, $500 match for the first 50 people who raise $500. That is hard to say quickly. So get on it if you haven't already. People can still register. And if you haven't registered and you'd like to register and help out, fundraise for one day. Do you know what you can do in one day fundraising? A lot more than 0 days fundraising. So hop on the bandwagon over at TogetheRide.org. If you want to make a donation, you can do that there as well. And of course, you can also buy a very cool, if you haven't already seen it, tie-dye bicycle kit designed by Team Totally Awesome's Mark Pierre Sanchez, and the proceeds go to Together Ride. So please get involved if you're not already. Get your friends involved. There's still time. We have 2 weeks left, and we look forward to seeing you when we wrap up on June 30th, but also in the interwebs and socials between now and then. Thank you everyone for being here, and a big thank you to Russell and Darrel for joining today for this conversation. Have a great day, everyone.